All right, Cooper, so here we are on the inside of your knee. This is the thigh bone cartilage, shin bone cartilage, and the meniscus on the inside of your knee, or the medial side, and all that looks really good. This, according to the MRI, was perfect. No problems over here, and I agree with it. It looks really good. A little bloody, but no damage to the meniscus or the cartilage at all in there. And then we're going to get a better look at the inside of your knee, or the lateral side of your knee, where they suspect the tear to be. But this part looks pretty good. In the center of your knee, there's your ACL. Let me see the probe. And the ACL looks pretty good. Didn't call any damage to the ACL on the MRI, and I agree with them. That all looks pretty good. The fibers of the ACL look like they're intact. And when we put it through motion, again, it's a little cloudy and bloody in here, but ACL looks good. A couple loose pieces of cartilage flaking around, but we'll find where those are coming from. But ACL looks good. So here we are on the outside of your knee. This is the thigh bone, then shin bone, and then the meniscus. It's kind of hard to tell, but it shouldn't displace this far into the joint. It actually reduced itself since the MRI, but I'm grabbing the tear and pulling it away so you can see how it's torn, and that's the part that we need to fix. So we're going to actually sew the meniscus back to the rim in the back and try to get it to hold in place. Back there is where it tore from. And we're going to try to fix that back in place. So the loose frayed meniscus tissue in the center, I'm actually using this wand to kind of melt back. Does a good job of kneeling the tissues back together without removing anything. But we're going to put all this meniscus tissue back. You have a little bit of a discoid meniscus, but we're going to repair that as well by doing a little bit of a saucerization. There's like too much meniscus tissue in here. So this is called a saucerization, where I cut out some of the redundant meniscus tissue. I'm going to use the direct left biter too. You've got a condition called a discoid meniscus, which kind of you have almost extra meniscus tissue left over from when you were developed, and it's not that strong as it should be, so it tears easier. So I'm going to trim out some of that redundant tissue, and then we're going to fix the rest of it back to the rim. So this guy just kind of is eating away some of the redundant tissue. Most people that have a discoid meniscus never know they have one, but it does increase the risk of it tearing, and that's generally the first time people notice they have one, is when it tears. Okay, let me see this shaver. Can you lift the foot of the bed up toward the ceiling any higher, or is it as high as it goes? It does it, okay. All these little loose pieces of cartilage and stuff, I'm just trying to get rid of those as we go. And then I'm going to use the rasp and a needle to kind of prepare the capsule for repair. So here I'm using a needle to kind of poke through the back tissue and into the back of the meniscus tissue. And I'm trying to create some channels in it and kind of make it bleed a little bit so that it'll help it to heal. I think using some of your own blood will help too. The whole idea is to try to bring blood to an area that's not used to having any. So this little needle device has a stitch on it that we're going to use to try to help repair the hold the scope, the meniscus back to the capsule. So I deployed one limb of the stitch. And I'm going to deploy the other limb of the stitch. And then kind of use that to sew to the capsule. Let me see the cutter pusher. Keep that right in the center. So this is me deploying one of the stitches here. So I usually put a couple on the top and then a couple on the bottom too, just to kind of help hold it steady. Alright, so we put one on top to pinch the top part down, and now we're going to put another one on the bottom to pinch the bottom part down and kind of march across the meniscus and get all those in place. Okay. Alright, I'll take the slide again. So we're just going to kind of march across the knee and put maybe 3 or 4 of those guys in. Alright, hold that for a sec. Alright. So we're putting, I've got 4 of them in here already. It's kind of hard to see because a couple of them are underneath, but this next one that goes on top, you'll be able to see a little bit easier. But I basically put the stitch in, and then it's almost like a lasso that you just tighten. So you kind of pull on it and it kind of tightens like a lasso or a noose. And then you cut the end of it. There you go. Yep. So we've got 5 stitches in here already, and if I grab on the meniscus, you can see how it's tied to the back. I think I might put one more stitch over here, just because that part is still a little torn, and then we should be good to go. Alright, so we're done. We put 7 stitches in there, and if I bend and straighten it, it doesn't look like it's going anywhere, so we just got to get this thing to heal. So we're going to squirt your blood in and we'll be done. So the cartilage under your kneecap looks pretty good. Really no damage there. No evidence of arthritis or anything underneath your kneecap. Looks pretty good. So we're just going to solid and then put your PRP in and we'll be good to go. Best of luck to you. So we've got the needle in place and I'm just sucking all the fluid out of your knee so we can get it completely dry. And then we'll put the PRP in. Kind of looks like a big bloody mess, but that's what we're doing. Alright, so we've sucked most of the fluid out of your knee, and this is what it looks like dry. And I'm just going to inject this right into the capsule where the meniscus repair was done. Put some right there. And I'm going to put a little bit more all the way in the back capsule. And that's it.